Welcome to the all viewers and well wishers of the world. The topic of today is malaria. It's a very common disease of the tropics and subtropics because of the bite of the mosquito, as one can see, and causing the malaria. Malaria should not be confused with miliaria, which is basically the heat rash seen in the hot season. So it is different from miliaria. It is a mosquito-borne infectious disease that affects humans and the other animals and the birds. Causes are the Plasmodium parasite spread by the mosquitoes, and host is the definite host is the female Anopheles mosquito, and intermediate host is man. Incubation period is Plasmodium falciparum 12 days, Plasmodium vivax 14 days, Plasmodium ovale 14 days, and Plasmodium malariae 30 days. It may be sometime 8 to 10 months or longer for some strains as incubation period. Habitat of this malaria is that sexual cycle occurs in the body of the mosquito, and the asexual cycle is seen in the liver and RBC of man. Now, symptoms are fever, vomiting, headache, yellow skin, and the complications are seizure, coma, organ failure, anemia, and sometimes cerebral malaria. Usual onset is 10 to 15 days post exposure to the infective parasite, and diagnostic methods are examination of the blood and antigen detection methods. Prevention is mosquito nets, insect repellent, and mosquito control medications. And the medication for the human use are anti-malarial medication. Frequency is 247 million people were affected in 2021, and there were about 619,000 deaths in 2021. Now, history of the disease is the term malaria originates from Italian word malaria, mean bad air. The term appeared in 1768, formerly called ague or the marsh fever due to its association with swamps and the marshland where the mosquitoes are breeding well. In 1880, French Charles Leviron observed parasites inside the red blood cells of the infected people, and he received the Nobel Prize for Medicine in 1907 for this discovery. In April 1894, a British Sir Ronald Ross proved mosquito was vector for the malaria in the humans. He isolated malarial parasite from the salivary glands of the mosquito, and he received the Nobel Prize in Medicine in 1902. Now, continuing the history, the first effective treatment for malaria came from the bark of cinchona tree that contains quinine. In 1820, active ingredient quinine was extracted. In 1940, chloroquine replaced the quinine, and artemisinin discovered by the Chinese scientist Tu Yu from the plant Artemisia annua in 1970s. To treat falciparum, malaria. She received Nobel Prize in Physiology or Medicine in 2015. The first pesticide used for the inside residual spraying was DDT. Later, it led to the pesticide resistant mosquitoes like antibiotic resistant shown by the bacteria. Malaria vaccine called RTS made in 1967 by using the live radiation attenuated sporozoites. And here there is the Charles Levinon, and here Sir Ronald Ross, those who received Nobel Prize in their field. And here there is the Chinese Tu Youyou, who have got Nobel Prize because of Artemisia annua, extraction of artemisinin. Now, epidemiology. The disease is widespread in tropical and subtropical region around the equator. It includes mainly the sub-Saharan Africa, Asia, and Latin America. Reason is the more rainfall, consistent high temperatures, and high humidity, along with the stagnant waters, all these favor the growth of the mosquito well. Some 247 million cases of malaria worldwide, I have already told you, resulted in an estimated 619,000 deaths in 2021. 95% it occurred in sub-Saharan Africa and commonly associated with poverty. Now, 84 countries have endemic malaria, and the children under 5-year-old are more affected, causing 67% of the total malaria deaths. Since 2015, by WHO, European region has been free of the malaria. There are about 1300 to 1500 malarial cases per year in United States. That is the control they have got over this disease. Decline is due to widespread use of insecticide-treated nets and artemisinin-based combination therapy used as treatment. Now, the cause of the malaria, single-celled microorganism parasites of the Plasmodium group cause the infection. In human malaria, 6 Plasmodium species are involved. Number 1, Plasmodium falciparum, then Plasmodium malariae, then Plasmodium vivax, then Plasmodium mavale curtici, then Plasmodium vallicari, and Plasmodium knowlesi. Plasmodium falciparum is involved in 75 cases and followed by Plasmodium vivax, which is seen in about 20% cases. Plasmodium falciparum account for the majority of the death. Plasmodium vivax malaria is also life-threatening, but not as it is Plasmodium falciparum. Plasmodium knowlesi rarely causes disease in the human being. And here one can see the Plasmodium falciparum, what they have got changes inside the blood. Plasmodium malariae, Plasmodium male, and Plasmodium vivax, Plasmodium vallicari. These are also involved in few cases. Similarly, Plasmodium curtici and Plasmodium knowlesi and Plasmodium vivax out of 3429. That is the fraction of these different malarial parasites. And malarial causes and the risk factors are bite from the infected mosquito, then it can be transmitted from the mother to the child transmission, that is called vertical transmission, then HIV positive patients are more prone to have that. And visiting the regions with malaria is very common, so one can have that. The visitors are very prone to have the problem. Now, the transmission of the malaria, mainly it is the mosquito vector Anopheles female responsible. Only female mosquitoes of the genus Anopheles prefer to feed on the blood at night. Male mosquito feed on the plant nectar and do not transmit disease. The other probability of transmission is blood transfusion rarely, then by the contaminated needles, then when the organ transplant is done, and congenital from the mother to the fetus. Now, wife, it is combination of WIFE, W wonderful, I item, F for, and E for entertainment. Husband, HUSBAND, handsome, U for useful, S for smart, B for but, A for at, N for night, and dangerous. But all these qualities of the husband can be only superseded by being the husband a rich man. Now, the life cycle of the malaria, there are two life cycles of the malarial parasite. One is sexual cycles, which is called sporogony, because here the spores are formed and ultimately lead to the sporozoite that occurs in the mosquito. The second is asexual cycle, that is called schizogony in man, and that leads to the formation of the schizont, which ultimately lead to formation of merozoites and others. Now, parasites are introduced by the bite of an infected Anopheles mosquito. Some of these inoculated parasites, called sporozoites, they remain in the skin, and the others enter in the bloodstream to invade the hepatocyte. They grow and divide in the liver for a dormant period of 8 to 30 days. Each infected hepatocyte become hepatic schizont that contain up to 40,000 parasites about. The infected hepatocytes, now these are called schizont, they break down and they release the invasive form of the plasmodium cells, which are called merozoites, into the blood. Now, here one can see the mosquito that just inject the sporozoites in the skin, and some of these remain in the skin and some are entering the lymph vessel and they go to the lymph node, and the other are going to enter into the capillary of the blood, and these reach to the liver cells or the hepatocytes, and in hepatocytes they are going to make the schizont or hepatic schizont, which rupture and release the merozoites. And now these merozoites are being taken by the by the RBC, and in the RBC, these merozoites transform the RBC to the RBC schizont, and here they do divide asexual reproduction, and ultimately they do change to the RBC schizont, and here one can see the RBC schizont with lot of parasite in them, and these parasites, some of them reinvade to the other RBCs, and some of these just transform and they do develop into the gametocytes, which are the male and female gametocytes, and these gametocytes are being sucked up by the mosquito when it is going to inject the sporocytes that just suck these gametocytes also, and these gametocytes do transform into the fuse, and they make the inside the mosquito sporogony, and ultimately they are going to form the sporocytes. So, starting from the sporocytes injected into the skin, taken up by the capillary and by the liver, liver make the hepatic cyzont, which release the merocytes that invade the RBCs. RBCs ultimately change to RBC cyzont, and that release the merocytes that reinfect the other fresh RBCs, and some of these develop into the gametocyte taken up by the mosquito to complete the sporogony. And this cycle is all the schizogony. Now, life cycle continued. The merocytes invade the individual red blood cells to form RBC cyzont. I have told you already, the replicating over 24 to 72 hours to form 60 to 32 new merocytes, which infect more and more new red blood cells, a cycle that amplifies number of parasites. A small portion of the parasite do not replicate and develop into male and female gametocytes inside the bone marrow for 11 days. Now they return to the blood circulation to await uptake by the bite of the another mosquito, continuing the life cycle inside the mosquito to complete the sporogony. Once inside a mosquito, gametocytes undergo sexual reproduction and form daughter sporocytes. These migrate to the mosquito salivary gland to be injected into the new host by the mosquito bites. And here one can see the sporocytes when they have infected the hepatic cells, these make the hepatic cyzont, and one can see there are thousands of the parasites inside the hepatic cyzont, and when it releases the merocytes, it do infect the RBCs, and one can see when the RBCs are having the parasite, they are going to multiply inside the RBCs, and now the RBCs are going to change into the RBC cyzont, and as one can see, there are many merocytes inside the RBCs. When it ruptures, it is going to attack the new and fresh RBCs, and these are also going to become like this, and then they are going to become RBC cyzont. Now, the liver infection, when the sporocytes are inside the liver, causes no symptom. Symptom results from the infection of the red blood cells. When the merocytes infect the red blood cell, symptoms develop when there are more than 100,000 parasites per millimeter of blood invading the RBCs. Many symptoms in the severe malaria are when Plasmodium falciparum bind to the blood vessel walls, that results in the damage to the affected vessels and tissue. Parasite sequestered in the blood vessels of the lung cause respiratory failure. In brain causes coma. In placenta, low birth weight and preterm labor increased risk of the abortion and stillbirth. Destruction of the red blood cells results in anemia, aided by the reduced production of the new red blood cells during the infection. Now, here one can see again very simple diagrammatic representation, and here one can see the mosquito, through its salivary gland, inject the mucocytes which are taken up by the liver, as one can see. In the liver, they multiply, and ultimately they become hepatic schizoid. When hepatic schizoid bursts, it releases the merozoites, and these merozoites that do infect the RBCs in the blood. In the RBCs, there is cycle now, there is replication of the parasite, as one can see the RBCs that has got the many parasites, and these parasites are just going to infect the new RBCs, and these are going to change into the RBC schizon, and this schizon, when ruptures, it is able to infect the new RBCs. But here, some of the schizons, that the parasite, they are going to transform into the gametes, and these gametes, as one can see, that are being taken and sucked by this mosquito, and when these gametes enter to the mosquito body, they transform ultimately by passing the different stages, and ultimately they come to the salivary gland of the mosquito and becoming the sporozoites, and these sporozoites are injected when this mosquito bite the human being and ultimately going to the liver. Now, pathophysiology. Infection occurs in two phases. One in liver, so that is called hepatic phase. Other in RBC, that is called erythrocytic phase. After a rupture of the RBC schizon, parasites invade fresh red blood cells. I have shown you already. Several such cycle occurs, and so leading to the classical waves of the fever due to the merozoites escaping and infecting the new red blood cells. Some Plasmodium vivax sporozoites do not develop into the hepatic schizon to form the merozoite, but they produce hypnozoites, as the name is hypno means sleep. So they produce hypnozoites that remain dormant for 7 to 10 months, typical to several years, and after a period of dormancy, they reactivate and produce merozoites. Hypnozoites are responsible for late lapses in Plasmodium vivax infection. And here one can see the mosquito host, as one can see the sporozoites. These sporozoites are being injected by these mosquito, taken up by the liver. Liver releases the merozoites and infecting the RBCs and becoming the RBC schizon, and these RBCs burst and they are going to infect the new RBCs as well as the gametocytes, which are taken up by the another mosquito, and they transform in the gut of the mosquito to the sporozoites in the salivary glands, and that is going to be injected to the another human host. Now, the parasite is protected from the body's immune system because for most of its human life cycle, it resides within the liver and blood cells. However, circulating infected blood cells are destroyed in spleen. To avoid this, Plasmodium falciparum parasite displays adhesive protein on the surface of the infected blood cells. These blood cells stick to the walls of the small blood vessels and releasing the parasites and avoiding the immunity of the human being. The blockage of the microvasculature causes the symptom, those in the placental malaria, and sequestered red blood cells can breach the blood-brain barrier and can cause the cerebral malaria. Now, pathology in the various organs of the body. In the blood, there is a high level of parasitemia, RBC destruction that leads to the anemia, which is of hemolytic type, hypochromic. Then there is leukopenia, and monocytosis. Bone marrow involved is causing the hyperplastic bone marrow. If the heart is involved, there is congested coronary blood vessels filled with the parasitized RBCs. In case of the lungs, there is pneumonic symptoms, alveolar capillaries filled with the parasitized RBCs, pulmonary edema, pneumonia, and severe anemia is seen. There is co-infection of HIV that increases the mortality. There is acute respiratory distress syndrome in 25% adults and 40% children, and 29% of the pregnant women. Cause is the metabolic acidosis. In case of the spleen, there is enlarged spleen, parasites, and hematin pigments phagocytized by the spleen and by the macrophages of the spleen. Now, here one can see the cerebral infarct in the brain, then retinal infarct, and the kidney failure in malaria. Then there are seizure if the brain is involved, and decreased venous blood flow because the vessels are involved, pulmonary edema if the lungs are involved, cerebral edema, then increased intracranial pressure and the herniation. These are all seen in malaria. Now, as the pathology in the various organs continued, in case of the liver, there is enlarged liver congestion and proliferation of reticuloendothelial cells. Liver dysfunction rarely occurs if another liver condition is there, like viral hepatitis or chronic liver disease syndrome is sometimes called malarial hepatitis. In case of the kidneys, toxin released cause the degeneration of the organs, congestion, necrosis, hemorrhage, and nephritis. Kidney failure is due to the black water fever, that is, hemoglobin from the lyse red blood cells, intravascular hemolysis that leaks into the urine and that causes hemoglobinuria. Then there is hypersensitivity to parasites, immune complexes, and the mediators lead to the nephritis and the black water fever. Here one can see the jaundice because of the liver involvement already, and there is superadded malarial problem. Then pathology in various organs. In case of brain, sticky parasitized RBCs block the capillary, so the tissue hypoxia, necrosis, thrombosis, hemorrhage, and the congestion is seen. Cerebral malaria, severe Plasmodium falciparum malaria with neurological symptoms, coma, Glasgow coma scale is less than 11, or a Blantyre coma scale is less than 3. There is retinal whitening, a usual clinical sign, and in case of the pregnancy, malaria with the Plasmodium falciparum and Plasmodium vivax in pregnant women cause stillbirth, infant mortality, miscarriage, and low birth weight. Then miscellaneous organs involved that is causing severe headache, low blood sugar, spontaneous bleeding, and coagulopathy and shock has been seen. And here one can see the enlarged spleen because of splenomegaly. Then there is brain involvement and enlarged liver, and there is the red plasmodium parasite that is going to cause the black water fever and urine, that is black urine because of the pigmentation of the malarial parasites. Now, the symptoms of the malaria. Typical symptoms are fever, fatigue, vomiting, headache, abdominal discomfort, and anemia. These are all due to the cytokine TNF, that is tumor necrosis factor. Severe cases, jaundice, shivering, joint pain, hemoglobin in urine, retinal damage, seizures, coma, and death occurs. In cerebral malaria, neurological symptoms, abnormal posture, nystagmus, conjugate gaze palsy, and opisthotonous posture is seen. The classical symptoms of the malaria is paroxysm, a cyclical occurrence of the sudden coldness or chill, followed by the shivering lasting 6 hours. It is followed by the sweating and fever relief without any medicine. And here one can see the clinical sign and symptoms of malaria. First, there are chills, and here one can see the cold stage of the fever. Then there is fever, and that is called the hot stage of the malaria. Then there is sweating, and that is called the sweating stage, and fever subsides without any medication. Now, symptoms continued. These symptoms occur every 2 days in case of the tertian fever, in Plasmodium vivax and Plasmodium ovale infection, and every 3 days, that is called quartan fever for the Plasmodium malariae. Plasmodium falciparum infection can cause recurrent fever every 36 to 48 hours or almost sometime the continuous fever. Children have more general symptoms like fever, cough, vomiting, and diarrhea. Initial manifestation of the disease common to all malaria are flu-like symptoms in the beginning, and it resembles conditions like sepsis, gastroenteritis, and viral diseases. So the symptoms of the malaria, systemic symptoms are high fever, back pain, profuse sweating. In case of the lungs, dry cough, and in case of the muscles, fatigue and ache. Skin, there is chills and sweating, and central nervous system involved, headache, spleen enlargement, stomach causing the nausea, vomiting and abdominal pain, and blood, there are bloody stool. Now, symptom begins 10 to 15 days after being bitten by an infected mosquito, or after several months after by the Plasmodium vivax strain, as I have told you, those which become hypnocytes and they go into the dormancy and they reactivate later in life. If not treated, people have recurrence of the disease months later. Those who survived an infection, reinfection causes milder symptom, that is because of the partial resistance. Travelers on the preventative malaria medication develop symptoms if they stop taking drugs. Severe malaria is caused by Plasmodium falciparum, called falciparum malaria. Symptoms arise 9 to 30 days after the infection. Now, here one can see the malaria by the mosquito, and the symptoms are headache, fatigue, chills, fever, vomiting, and nausea. I have already